Convenience versus precision. A guide to at-home cancer screenings as healthcare shifts toward greater patient autonomy. At-home cancer screenings are becoming an increasingly popular alternative to traditional clinical visits. These tests offer a vital bridge for individuals facing barriers to care such as limited transportation, busy schedules, or significant anxiety regarding medical procedures. However, while convenience is a major benefit, it comes with a trade-off. Traditional in-office procedures, such as colonoscopies, remain the gold standard for accuracy. At-home tests are generally designed for individuals at average risk. Those with symptoms or a family history of cancer should prioritize direct clinical evaluation. Prostate cancer. The PSA finger prick test prostate-specific antigen, PSA, levels in the blood can indicate the risk of prostate cancer. While traditionally performed in a lab, at-home kits allow for self-collection via a finger prick. How it works. You collect a small blood sample using a needle provided in the kit and mail it to a laboratory. Who it is for? Individuals at average risk, no family history or other risk factors. Important considerations. Most at-home PSA tests are not FDA approved for home use. High PSA levels do not always mean cancer. They can be influenced by age, medication, or an enlarged prostate. Recommendation. Generally suggested every 2 to 3 years starting around age 50. Cervical cancer. HPV self-collection standard cervical screening usually involves a pelvic exam and a pap smear. For those uncomfortable with speculum exams due to pain, anxiety, or past trauma, FDA-approved self-collection kits offer a discreet alternative. Available options. The Teal Wand and the Onclarity Self-Collection Kit test for human papillomavirus, HPV, the primary driver of cervical cancer. How it works. You use a swab to collect a sample internally, similar to a doctor's procedure, but without the need for a pelvic exam. Key limitations. These tests are not for those with a history of cervical cancer or abnormal previous results. A doctor's prescription is required. Frequency. Because these are self-collected, they must be repeated every 3 years, whereas doctor-performed HPV tests may only be needed every 5 years. Colorectal cancer. Stool-based screenings. Colorectal screening typically begins at age 45. For those at average risk, several at-home options exist that bypass the intensive prep and sedation required for a colonoscopy. Guaiac-based fecal occult blood test, GFOBT. This test looks for hidden blood in the stool, which can signal polyps or cancer. Process. You must collect samples from 3 consecutive bowel movements and smear them onto a card. Note, you may need to avoid certain foods, like red meat, or vitamins, like vitamin C, before testing to avoid false results. Frequency should be repeated annually. Fecal immunochemical test, FIT, a more modern and user-friendly version of blood detection. Process. Requires only 1 bowel movement sample. Benefit, unlike the GFOBT, there are no dietary restrictions required before the test. Frequency should be repeated annually. Multi-target stool DNA test, MTS-DNA. These advanced tests, such as Cologuard, look for both hidden blood and specific DNA/RNA changes associated with cancer. Process, you collect a sample from 1 bowel movement and mix it with a provided solution. Requirement, a doctor's prescription is mandatory. Frequency, typically repeated every 3 years. Summary table. At-home screening overview cancer type primary test method frequency, key requirement prostate PSA blood. Finger prick. Every 2-3 years average risk only cervical HPV self-swab every 3 years doctors. Prescription colorectal GFOBT, blood. Annually dietary restrictions may apply colorectal FIT, blood. Annually no dietary restrictions colorectal MTS-DNA, DNA blood. Every 3 years doctor's prescription final note. At-home tests are screening tools, not diagnostic certainties. Any positive or inconclusive result must be followed up immediately with a medical professional for clinical confirmation.